Okay, everybody, I will go ahead and get this party started. You guys have the honor of getting to listen to me read off the disclaimer statement. So just bear with me as I do this. Our UNIGHT virtual forum is educational and supportive in nature and will offer self-care strategies to help you in your daily life. However, the group will not engage in any individual or engage in any rendering any psychological healthcare advice for any particular individual or situation, and will not provide medical, mental health, or other type of health related service. No diagnosis, treatment recommendations, medication advice, or any other type of medical or mental health recommendation will be offered. Our support group is not a substitute for or alternative to treatment by a licensed medical professional. Always seek the advice of your own physician or another qualified health provider with any questions you may have regarding your medical condition. The Hypersomnia Foundation does not recommend or endorse any specific tests, physicians, lawyers, legal advisors, products, medications, procedures, opinions, or any other information that may be referenced on its website or during any online support group. So with that, I want to go ahead and get this started. Also wanted to remind everybody that coming up on November 7th, Hypersomnia Foundation will be hosting its Beyond Sleepy virtual conference. It is going to be completely virtual this time. So feel free to check out the website for information on registering for that. So it is my pleasure and honor to introduce to you Dr. Lindsay McCullough. Dr. Lindsay McCullough is an assistant professor of medicine and associate program director for the Sleep Medicine Fellowship at Rush University Medical Center in Chicago. She earned her medical degree from the University of Florida College of Medicine and completed her internal medicine residency and sleep medicine fellowship at training at the University of Florida and Rush University Medical Center, respectively. As both a sleep physician and someone living with type 2 narcolepsy, Dr. McCullough brings a unique perspective to her practice and teaching. She is a fellow of the American College of Physicians and passionate advocate for sleep health education, emphasizing the importance of community support alongside medical treatments for patients with sleep disorders. Her personal journey with narcolepsy was featured in the fall 2022 issue of the American Academy of Sleep Medicine member magazine, Montage. So that is the official introduction. I want to give a personal one because Lindsay is one of my favorite people in this space. She is uniquely positioned to talk about the physician patient interaction as someone who both has narcolepsy and is also an expert in her own right. I always enjoy talking to Lindsay because I walk away more educated and more knowledgeable about the topics every time we talk. And not only that, but she's an amazing friend as well. So with that, I'm going to turn the conversation over to Lindsay. I want to remind everybody that there will be a Q&A afterwards, so please keep your mics muted. If you do have questions that come up during the presentation, you may put them into the chat, but we will likely refer to those at the end after Dr. McCullough is finished. So with that, Lindsay, I pass the ball to you and look forward to hearing you present.
Thanks so much, Matt. And thank you to the Hypersomnia Foundation, everyone for having me here today. I learned so much from all of you as well. And yeah, it's just a pleasure to be in a space where we all are together and can share our experiences and know we're not alone. And I just shared this, but hold on.
Yes.
Yay. All right. Thank you all.
Absolutely.
I'm doing this in person. I have a flash drive, so okay. All right, so talking about making every minute count, strategies for effective doctor visits. I'm just gonna hop right in and I'll explain to you why I feel this is important throughout the discussion. A little bit about me. Matt already introduced me as someone living with narcolepsy as well as a sleep medicine physician. I'm originally from Florida. I like to say I escaped and made it up to Chicago, Illinois, but still a big Florida sports fan. And when I'm not, focused on improving and helping treat hypersomnia disorders, I also have a niche in helping patients who have different sleep surgeries like Inspire and people who can't tolerate CPAP. And this is our crew presenting on that at the sleep meeting. So why is there this big doctor-patient communication problem, especially in hypersomnia disorders? So one big thing is a lot of providers, physicians, nurse practitioners, PAs lack the education and knowledge about hypersomnia disorders. Another thing is we have different vocabulary for describing things, and you learn kind of medical jargon when you're in your medical training. Patients often describe things differently, and if that doesn't align, the paths can cross and it not work out. There's some testing limitations we'll talk about, resource constraints we'll talk about, and then everybody's a little bit different in terms of their goals for treatment. So kind of figuring out what is best for the individual can be, take some reflection and take some time to get to. So speaking of education, this was the sole education about narcolepsy I got as a medical student. Let's see if we get this to work.
This dachshund, Rusty, suffers from narcolepsy, a condition that causes him to suddenly fall asleep when he's trying to do other things. Little is known about the cause of narcolepsy, except that it can be inherited. It affects humans and animals alike.
So that was it. And not only, I mean, Rusty's very sweet and cute. I love dogs, but it's showing cataplexy with the loss of muscle tone, but says that it's suddenly falling asleep. So it, is a bit confusing in terms of symptoms and some inaccuracies. And this survey is now old. It would be great if we could redo this, but the Awaken survey was done back in 2012 and asked the general public and healthcare physicians how well they recognized a variety of different conditions, and narcolepsy was one of them. And in terms of the general public, 70% had heard of narcolepsy, and they asked also about things like MS and diabetes and Alzheimer's disease, but narcolepsy was the lowest one that people would recognize. Only 7% of those 70% considered themselves very or extremely knowledgeable. Only half of the 70% believed that it could impact a person's overall health, and only 55% of those considered the disease a serious condition. So I think, people make light of narcolepsy if they've heard of it. And in terms of primary care doctors, who may be the ones that you'd see if you're feeling sleepy to try to pick up on these conditions, a quarter of them felt very or extremely knowledgeable. Less than 10% could identify all key symptoms. Less than 10% felt extremely comfortable with the diagnosis, and less than half could recognize the two prominent narcolepsy symptoms. Even more scary, the sleep specialists, they looked at 100 of them. 62% felt very extremely knowledgeable. Only 22% could identify all 5 key symptoms. Less than half felt very or extremely comfortable with the diagnosis, and 63% could recognize the 2 prominent symptoms. My hope is that we're doing better than we were in 2012, but this still just gives you an idea of, the delay in diagnosis may be related to physicians not picking up on this. And looking at hypersomnia and IH, this was looking at actual physician perspectives, which I thought was interesting. Jazz and the Hypersomnia Foundation did this survey a few years ago and looked at sleep doctors and non-sleep doctors. And just the overall message that I got from this is many doctors feel like they want to understand IH more, but they do not feel like they understand it. There needs to be more education. They think that patients are misdiagnosed with depression and anxiety, feel like we're missing these patients. It's challenging to diagnose IH. 39% reported it takes 2 to 5 years to get an accurate diagnosis, which is way underestimating how long it usually takes. And almost all said they agree that IH negative impact on their life is significantly underestimated, that more education is needed, that 87% said people living with IH are frustrated with their healthcare community, and 95% said those living with IH are frustrated with their disease management. 66% said people with IH do not feel understood by the general public. So the physicians understand this, and I think want to do better, and it takes a village. But I hope that this shows like, hey, the physicians are aware and want to do better and want to learn. And there's still, I think, in the field, a lack of education and knowledge surrounding IH. And talked about the language barrier, excessive daytime sleepiness, sleep attacks, automatic behaviors, and naps. We were teaching our fellows over the last couple of weeks. We had more intense lectures about the hypersomnia disorders, and sleep attacks came up a lot. Like that was the thing that would characterize narcolepsy, for example. But a lot of people with narcolepsy don't have the sleep attacks. And people might come in and say that they're tired or they're fatigued or fighting sleep. So this was an interesting article looking at the different language changes and things to look out for. The other thing is when our testing methods right now are not great for narcolepsy 2 and idiopathic hypersomnia. The overnight sleep study and next day study are what we have. But studies have shown that like people who test positive for using this testing method, if they have narcolepsy type 1, 91% will test positive twice. But narcolepsy type 2 and IH, that's about half, a little less than half. Dr. Trotty has done a lot of research looking into this. She had a cohort of 36 patients and looking when they had an overnight sleep study and next day sleep study or the PSG MSLT, half of those patients had a change in diagnosis between narcolepsy type 2 IH and normal. And only 33% of the patients who had the diagnosis of narcolepsy type 2 had a second positive MSLT, just a third. And as I've gone along in my training and learned more about this, it was validating to me because when I first got my diagnosis, the doctor was like, it's a little bit unclear if you have IH or narcolepsy type 2. I went back and forth. I talked to a neurologist. We looked at your nap to see if you entered REM. Eventually we, decided that you probably did, but just this lack of certainty and clear diagnosis was a little bit unsettling. And, you can think, I trusted my doctor 100%, and I know that there's limitations in testing, but you want to hear from your doctor, like what you have and concrete steps on how to fix it. And I think with narcolepsy type 2 and IH, we still have a long way to go. We need some alternative diagnostics. Okay. Shifting gears just on the testing vocabulary constraints. This will drive me crazy. Doctor scheduling woes. So every institution's a little bit different, but the healthcare system is really stressed. It was stressed before COVID, but I think COVID made it worse. And a lot of doctors are retiring and leaving. There's a lot of battling with the insurance companies. There's a lot, it's hard to keep support staff. So the doctors that you are seeing in it, they really care and want to help, but their schedules might be booked up. So here's, for example, I've adjusted my schedule so that I'm doing clinic multiple days a week, and I go from like 8:30 to 2:30, because other than that, my brain's like, okay, you're done, Lindsay. But we are double booking because people don't show up. And we're, every half hour. And a lot of times everybody does show up. So it makes it hard. I find that I wish I had at least an hour to talk to my patients with hypersomnia, and I just don't. This is the time that you have from checking in, getting your vitals checked, your meds checked, seeing the medical assistant, signing the note, all of those things. And here's my colleague, who has 17 in a day, multiple double book sessions. So if you feel like your doctor's kind of in and out, this might be why. And also, like, thinking about this, it's good to plan how to be efficient and get the most out of your visit. So that's what we're going to jump in and talk about, how to prepare. So the first thing is thinking about how a doctor takes a history. When you first meet a doctor and you have an unclear symptom, they might ask you, in any visit, you want to know, what is your biggest concern? We call it the quote unquote chief complaint, but what is the biggest thing that's bothering you? And kind of honing in on that. What brings you in, so that we can figure out a way to address that. And I know sometimes there can be multiple things that are impacting, but if we can focus in on the most important thing, most important symptom, then we go into, this is, old carts, or there's these other mnemonics, but like asking essentially, what is the symptom? How long has it been going on? Is it worse at a particular time of day or at night? Does anything make it better or worse? If you're coming in and saying like, I'm tired, is it sleepy? Are you dozing off? Or is your body just like tired and you can't sleep? Or is it like a brain fog, concentration issue? How long does it last? And thinking about severity, how is it impacting your life with specifics? So if you can give real life examples, that can be more impactful than just saying like, I'm just tired all the time and um, I can't enjoy my life. Like, were you written up at work or school due to tardiness? Were you like, has this taken a toll on your romantic relationship? Have you not been able to be intimate because you're so sleepy and dozing off all the time? Um, Unable to stay awake at the wheel when you're driving despite getting enough sleep, driving off the road. So all of these real life examples, I think, can help hone in and help you figure out goals with your doctor and what to work towards. So this is a new book that Dr. Anne-Marie Morse just authored, just came out, that I've been enjoying reading. And it's for both physicians and patients to read to help with communication. And one of the things that she talked about that I have here is creating a progress map, or the way I think about it is like, what does a 10 out of 10 year look like? So thinking about, where am I now? Where do I want to be specifically, so that you can find a roadmap to try to get to that place. And a 10 out of 10 year could be, I mean, when you're thinking about it, dreaming big, but also thinking about what's realistic. I was thinking before this, I mean, somebody might say, oh, I want to get my PhD in 3 years and raise my 2 kids and not feel tired. And that's like not realistic for somebody who doesn't have a hypersomnia disorder, doesn't have anything else going on. But thinking about like, I would have a 10 out of 10 year if I could, you know, get my adequate sleep, feel good, be able to make dinner for my family twice a week, because that's really important to me, and spend time with my family twice a week. And be able to hold my job and get my work done at work, something like that. And so these are just these tips with this progress map that you and your healthcare provider potentially could work on, so that you can find ways to implement changes, whether it's medication, lifestyle, work accommodations, everything together, and check in to see your progress. Okay. So let's say that's more big picture, but thinking about your appointment as it's leading up to it, whether it's 2 weeks before your appointment or you're doing this ongoing, I think it's helpful to, as the day winds down, reflecting and write about your day, and thinking about, what's your most bothersome symptom? How specifically did it challenge you or impact your day? And also thinking about 3 good things that happened that day, how that made you feel. I've found personally that I can dwell in all of the things that narcolepsy, I feel that narcolepsy takes away from me and like my energy, but I also think I might give it too much power, and like there are normal things that might make me feel tired, or like I did this amazing thing and like I'm hard on myself because I made one mistake, right? So I don't know, thinking about the good things I think is really important and helpful. So when you're doing this, having some sort of like activity and sleep journal or symptom diary, or like, people have different ways of putting it. The Hypersomnia Foundation has a great journal with examples on how to do this. And putting this together each day. A couple weeks before your appointment too, if you, it can be helpful to have a family or friend accompany to you to the appointment. So if you want that, making sure you contact them with enough leeway, nice lead time. Make sure you know what medications you're taking, along with supplements and doses. And then if you need an interpreter, make sure you request that before the appointment. Having an in-person one's definitely ideal. Going back to setting, goals and expectations, make these goals realistic and specific, and you can work with your doctor on this, but it's helpful when you're reflecting on all of these things before you're leading up to the visit to have thought about some of these things. Let's see. The day before your appointment, review your notes from the past week, and then have a one pager that you can bring in that tells you where you summarize kind of your biggest sleep or weight concern affecting your life with 1 to 2 real examples and 1 to 2 specific achievable goals. Thinking about things I'm also asking about are your sleep habits, what time you're waking up, what time you're going to bed, how many hours of sleep, how long it's taking you to fall asleep, how often you're waking up. Also writing down your questions and concerns and prioritizing what's most important ahead of time, knowing that there is that limited time and you want to make sure you get your most important questions answered. Have a list of those medications, set aside your supplies like a notebook and pen with your reflections and sleep schedule, get lots of rest before your appointment, confirm with your family or friend joining you before the appointment. And I think just kind of honing in on these achievable goals, just thinking about what's important to you, like what do you value most, and what do you want to get out of your treatment? Because there's no magic wand or things that are going to completely reverse this, but what can we do? What would make your life better, and something that's measurable that you can see progress with? All right, during your appointment, have that one pager ready. Be totally open and honest during your appointment and ask questions if you don't understand. Thinking about the one goal you'd like to achieve between that appointment and your next appointment, writing that down along with specific action items. Also, it's okay to ask for a handout or specific instructions with your medications, sleep timing. Also, something I think is really important is before you leave, just schedule that follow-up appointment, because wait times are very, very long. I learned this week that apparently if you see me today, my next available is in May, which does not make me happy. There's cancellation lists and things that you can get on, but it's just a big frustration of mine right now that you can check in through messaging and things like that, but it's just the touch points may not be there as much as you'd like, or as much as I'd like. Okay, so after the appointment, once you get home, you can review your notes and goals and your action plan. Check in with yourself each week. Have you been able to move closer towards that goal? And yeah, don't hesitate to reach out to send a message to your doctor if questions, or try to call to move up your follow-up appointment if possible. The other thing that I think is important to reflect on is not everybody is a good fit for everybody, and making sure that you have a good fit with your doctor is important. Are there any non-negotiables that you have that you want to make sure that the person that you're working with, you feel comfortable with, they're willing to work with you in different ways. I think this is getting better, but I think a lot of physicians were hesitant to prescribe things like the nighttime medication, the oxybates. But if that's, something that you feel like you need or want, and you're getting a lot of resistance, maybe seeing somebody else, things that are personal to you. Okay, so in summary, I think there's hope in diagnosis and treatment of hypersomnia disorders. We need better diagnostics, but I think there's still this hope here. We were talking about different clinical trials going on too, and some areas of hope there, but also some challenges in getting to those places and getting able to get on those clinical trials. I think there's a lot of things to be hopeful for, but everyone's journey is unique and we're gonna have ups and downs. And having teamwork between you, your doctor, and the patient organizations is important. I rely so much on these groups and the other patient organizations to not only help provide extra information that I don't have time to give during the appointment, but also to create that community and that social support that I think is so important in managing living with these conditions. There's a shortage of sleep physicians. Doctors are burning out, leaving the profession, which leads to longer wait times. And you want that appointment to be effective. So come prepared with what's bothering you the most and your questions, specific examples on how that symptoms are impacting your life and your goals. Know your typical sleep schedule, all your medications and doses. Bring someone with you to the appointment. That can be very helpful. Please remember that your doctors are human. Try to give them some grace. I think they all want what's best for you and to help you do better and live better lives. It's also important to recognize when to move on, but we are human. And yeah, don't hesitate to follow up with questions. These are some of my sources if any of you all are interested. I will stop sharing so we can do our discussion.
Awesome. Thank you so much.
All.